Okay. All right, let's get started. Uh, Hello, my lovely people. A very warm welcome to everyone who are joining us today. I'm back with our special guest, Dr. Namrata from Sunshine Skin Clinic. She's a skin, hair, and laser surgeon in Delhi. Her clinic was awarded the Best Skin Clinic in Delhi in 2017. She has also been featured on NDTV Good Times, Radio Mirchi, and Radio City. And you can also find her on Sunshine Skin Clinic Official on Instagram. Hello, Dr. Namrata. How are you doing today? We haven't
I'm doing
been
great,
able to do
and
this.
it's nice.
Yeah,
Yeah, it's nice to be back after a few weeks. So we are doing a different kind of thing. I think today we are going to answer some, very attractive list of questions which are
yeah,
Google and they are very frequent questions. So it will be good to answer them and help people.
yeah. Yeah, today we are going to have a very interesting session. I'm going to ask Dr. Namrata a few questions as usual, but these questions are some of the most Googled questions regarding skin and hair. I'm sure many people would have these kind of concerns, and I hope we can help them with these questions because they are so simple, such simple questions, but everybody have these kind of questions. So let's get started. I'll ask the very first question. It is, why do I get breakouts out of nowhere? Because sometimes people might get breakouts but don't know the reason. So, why do people get it out of nowhere?
See, now breakouts are very common thing and it happens in all the age groups. It could be young children, very small children, newborn children, teenagers, elderly people, middle-aged women. So why does it happen? See, if they are newborn children or they are young children up to the age of 10 years, sometimes they may get small, small pimples all over the face or especially pimples which are more concentrated on the forehead. So that could be due to dandruff or seborrheic dermatitis, and it could be in all the age groups also, except children also. So what happens is that sometimes we oil our hair, we love oiling our hair so that it grows well, and we keep the oil throughout the night. So it increases the sebum extent in the hair follicles,
Yeah.
sebum content in the hair follicles, leading to oily dandruff, and oily dandruff will give you breakouts on the forehead, on the sides. Okay, and it can happen in any age group. It could be children, it could be teenagers, it could be middle aged or elderly because oil apply oil. So seborrheic dermatitis or increased oil content in the hair follicles is one cause. The other cause is that we go out in the sunlight a lot. So sunlight also can give rise to the acneiform eruptions known as polymorphic light eruption, which is also a cause of breakout. Sometimes we may use some kind of skin products which have oily content like shea butter, or they could be rich in glycerine or very high in oily butter kind of creams, which can again give rise to breakouts. So these are few general reasons for breakout. The other important reason could be some kind of hormonal disturbance in the body. It could be a polycystic ovarian disease, a hormonal disorder of women, wherein there are cysts in the ovaries and the female hormone gets converted into the male hormone, giving rise to breakouts. People could have thyroid issues, which give rise to breakouts. Sometimes you may have a upset stomach. You may be suffering from acidity or digestion issues. You may be having constipation, so because of that, you may get breakouts. Or sometimes you may be eating very, very spicy and oily food, which disturbs your digestive system, leading again to breakouts. Some kind of cheesy food products.
So, does, yeah, that's what I was going to ask.
Yeah, sometimes pizzas and burgers and the mayo and the cheese which we use can also give
Yeah, I
rise to
was going to
eruptions.
ask, oily food also leads to
Yes,
breakouts.
excessive consumption of chocolates. Chocolates have a component called nickel. It also can give rise to breakouts. Sometimes consumption of too much of mangoes, they produce heat in the body, leading again to some kind of digestive system problem can give rise to breakouts. Consuming too much of sweets. It could be the drinks, it could be the soft drinks or any kind of Indian sweets which are rich in high sugar content and ghee can also give rise to breakouts. So these are few common causes of breakouts. It could be excessive oily scalp, it could be excessive sunlight exposure, it could be hormonal disorder like PCOD or thyroid, it could be consumption of oily, spicy, sugary food, aerated drinks, which can give rise to disturbed digestive system leading to acne. It could be use of some products, could be face wash, could be shampoo, or could be creams or some kind of makeup which can give rise to breakouts. So this is a general list of the causes of breakouts which can happen all of a sudden, leaving you in a dilemma as to why did it happen.
There was another question before regarding breakouts due to vitamin C. So, does consumption of vitamin C also causes breakouts?
It's not consumption of vitamin C which will ever cause any breakout because it's a water soluble vitamin and very good for the skin. But sometimes the vitamin C serums which are available in the market in the concentrations of 15%, 25%, sometimes those serum applications due to irritation of the oil follicle may give rise to the oily eruption, to the acne eruptions. It could be one of the cause. But it is the application, never the consumption.
Okay. And for these breakouts, do people just wait for them to go away, or try to figure out what the cause is and then maybe fix their diet, or do what they like, try to
See,
fix the things that have caused the breakouts?
you have to fix the things which have caused the breakouts. If it is an oily scalp, fix it. If you have eaten something wrong, fix it. Because I remember my patient, and not take her name. She is a hotel chef and she works in hotel industry. So she's always there with, and she has a sweet tooth. So whenever she used to consume any kind of gulab jamun or any kind of Indian sweet, she used to have a breakout. So this she noticed herself, and once she stopped doing that, her breakouts were gone. So you have to notice as to what thing is triggering. I have given you the list. So correct it. Otherwise, if it is still coming, then you have some, applications of creams which are rich in clindamycin, erythromycin, nedifloxacin, which can cure your pimples. So you can apply these creams. Don't pick on the pimples so that they don't leave any marks.
Okay, that was very helpful. And now moving on to the next question. It's, why have my hair started to fall? Sometimes people don't know why their hair start to fall out of nowhere. Suddenly you might see hair fall, and then it's very confusing. A lot of people say it's stress, but then sometimes you don't know that you're stressing, but maybe it's causing a toll on your hair, on your body. So why do people suddenly start having hair fall?
So see, hair fall is a very, very common question. I think we have answered it so many times. So you have to note down the list of the causes of hair fall. The first most important cause be hemoglobin or iron deficiency in your body. So you have to check your ferritin levels, your iron levels, your hemoglobin levels. Liver function test. Any kind of liver abnormality or digestion abnormality can give rise to hair fall. That means your food is not getting digested, your liver enzymes are not working. As a result of lack of nutrition, you're having a hair fall. The other reason could be vitamin D or vitamin B12 deficiency, which can again give rise to hair fall. Another common cause is thyroid disorder, polycystic ovarian disease, which can give rise to hair fall. Whey proteins is a very, very common cause of hair fall because the consumption of whey proteins increases the level of male hormones in your body, that is testosterone. So testosterone when it increases, it binds to 5-alpha receptors which are present on the front, top, and sides of the scalp, and it leads to the production of a hormone known as DHT, which can reduce the blood supply, cause thinning of your hair, and ultimately lead to baldness. So these are some common causes, and in men mostly they have androgenetic alopecia, which is hormonal hair fall. So all of them will suffer because I told earlier also that this part of the scalp is rich in 5-alpha receptors. So the male hormone binds to this receptor, forming DHT. DHT reduces the blood circulation around the hair fall, so around the hair follicle. So first the hair become thin, and then they start to fall, leading to baldness. And whey proteins can increase this. And Excessive oily scalp or dandruff is also a cause of hair fall. People who have tuberculosis and are on drugs for tuberculosis, or who have suffered from some kind of medical problems, could be coronavirus, COVID 19, could be jaundice, could be typhoid, could be pregnancy. All these people may also have a lot of hair fall known as telogen effluvium. Means your body was under some kind of stress, some kind of medical stress where you had dengue, you had malaria, you had typhoid, you had jaundice, and you had corona. So your hair follicles went into the resting phase known as telogen effluvium, and you may suffer from a sudden spurt of hair fall. So that gets recovered after 6 months. Even pregnant ladies post pregnancy may suffer from this. So there is nothing to worry. It will gradually come back, and we will give you some kind of hair supplements which will really help you. Definitely some kind of
So we
stress,
have
everyday stress, which gives rise to hair fall, but there is some kind of stress which we are unable to manage, which is consuming our energy, can also give rise to hair fall. So we have to do meditation or eat right or exercise to overcome that. Yes, I'm seeing one question on the screen. Do biotin supplements work for growing hair? Yes, Nicole, they definitely work for growing hair. Biotin is one of the B complex vitamins which promotes the growth of the hair follicles, and it works like a fertilizer for the hair. So, this is a good supplement, but unless and until we find out the root cause and just take biotin, it may not work alone. So, find out the root cause, and then when you eat such supplements, they will help. Another major cause of hair fall is women and men both going into coloring hair, using lots and lots of color which has PPD, ammonia, and chemicals which break the hydrogen sulfide bonds of your hair follicles, giving rise to hair fall. Too much of hair gels, hair treatments like keratin and hair softening and perming and straightening. All these things weak your hair, make your hair go weaker and weaker, giving rise to lots and lots of hair fall. So all that has
So
to be
when
kept in.
these things, when the cause is, hair straightening, perming, and these kind of things, once you stop doing these treatments like dyeing your hair, perming your hair, does the hair grow again, or is it a permanent damage?
It becomes little. It is not permanently damaged, but to recover it, it almost takes 6 months to 1 year, under which you have to apply serums, you have to eat medicines, you may have to go to your dermatologist and start taking treatments like stem cell therapies, start taking treatments like mesotherapy. So you will have to undergo lots and lots of treatments to bring back your hair follicles to normal. It is not an easy job. So it may take approximately 1 year to bring it back to normal. So be very careful before you go in for such kind of treatments. Perming, straightening, and all these things are not very good. And I always advise that if we want to be in the fashion industry and we really feel like doing, we get bored of the normal hairstyle. Please get beautiful extensions made matching your hair, and you can try all this on the extensions. Leave your natural hair as it is. Put extensions and do whatever you want to do. You can do coloring, you can do straightening, you can do perming, and you can just hide your own natural hair to be there for you in the long run. That's a good
Yeah, that's
idea,
a
I think.
very good idea.
Yeah.
Yeah. Okay, so let's move on to the next question. It's, do sheet masks really work? This question I also have. Lately there's been a lot of trend coming from Korea mainly, of sheet masks, and so many of them available in the markets. But I always do
Yeah.
wonder, do they really work?
See, sheet masks, the concept of sheet masks, it originated in Japan and South Korea, and they have been using them for very long. Now, what are actually sheet masks? These are masks which could be made out of paper, they could be made out of fiber, or they could be made out of some gels, and it is in the shape of your face. So it has those eye cards and that nose cards which can just get pasted on your face, and usually it is dipped in nutrients which are rich in serums like vitamin C, hyaluronic acid, sometimes rice water, sometimes brightening agents like arbutin and licorice. So these are nutritionally very healthy sheet masks, and usually they are applied on your face. So how they work is, and when they are applied on your face, they have this sheet layer. So the nutrients which go into your skin, they do not get evaporated, and they can get absorbed in your skin slowly, and the absorption is prolonged. So they really give you good results rather than just applying a mask. But sheet masks will benefit you only after you have exfoliated your skin. Meaning, if you have a lot of dead skin on your face and you apply a sheet mask, it may not really work. So once people come to our clinic, we do polishing, we do dermabrasion, we can do water and oxygen exfoliation. We first exfoliate the dead skin. We massage the skin. We put nutrients into the skin. We can do some electrophoresis or microcurrents to increase the circulation. Now, once we do all those things and then we put the sheet mask, the nutrients really get absorbed into your skin. Putting a sheet mask just like that may not help. Now, if you are at home and you are unable to go to a clinic or a parlor, whatever, then at least use some kind of scrub so that your dead skin comes off and your skin should be in a position to scrub. If it is very, very dry, please don't scrub it. You can just clean it well with a cleanser so that the dirt and the chime, it all comes out. And then you put the sheet mask. So once you do all this and then use sheet mask, they really work. And you have to buy a good quality sheet mask from a branded company. There are many companies just selling it which are not high quality. Then it may lead to some reaction. So use good quality sheet masks which have that USA FDA approved stamp, and then only use them. And use
And
them only and only after exfoliating the skin. Yeah.
okay. And
Yeah.
the nutrients that go in from this sheet mask, is it just a temporary solution, or is it something if you do it and that day or next day your skin will be moisturized and hydrated, or is it a long-term effect that these sheet masks give?
See, sheet mask may give you good results for at least a week, 15 days if you have exfoliated your skin or taken a procedure at a proper dermatological clinic. And then, if you are just using a sheet mask, it may just stay for a day or two. And again, I will, specify that all the things, whatever procedures we are doing are external. You have to follow your regime of cleansing, toning, moisturizing, using a sunscreen, and then once in a week or once in 15 days when you use sheet masks, they really work. But if you just use sheet masks and you are not using a good lifestyle, or your general health is not good, or you're not protecting against the sun, or your water content and your general health is not good, then alone sheet masks may not give you a very good improvement. You may feel good for a few hours and then again you are back to your dull skin. So you have to follow your lifestyle and then exfoliate and then use, and then it will really help.
Okay.
Otherwise, it's just a temporary solution. And a very important thing I want to stress on is that many people who walk into my clinic, they always ask me that whatever treatment are you doing, is it permanent or is it temporary? See, your body weight, your skin, everything keeps changing every day according to the environmental changes. Only your height is fixed. Your blood pressure, your sugar levels, your heart rate, everything changes. So, you have to have a good lifestyle to get good results in the long run. We cannot assure you that this is permanent. Only if you are maintaining your lifestyle, you're sleeping well, you're eating well, you're following your cleansing, toning, moisturizing routine, and then you're taking these treatments, then they will stay for long and the results are long lasting. Long lasting means you have to get a maintenance once in 2 months or once in 3 months. It's just like if you go to a gym and you reduce weight and make a good body, you can't ask your trainer that, am I going to be permanently thin? You have to maintain it with a regular regime, your diet. Only then you
Yeah.
can be fit. The same holds for skin and hair. We can bring you to a certain level, but in order to stay like that, you have to maintain it with maintenance therapies of all your skin and hair treatments, and using your sheet masks once in 15 days, and then only we can give you a long lasting effect.
Okay. Thank you for that answer. And let's move on to the next question. How to get rid of dark circles? Uh, it's something that, especially in India, a lot of people go through.
Mhm.
And what, from my experience, what I've heard is sleep well, drink a lot of water. But sometimes you could be doing that and you'd still have dark circles. So, what are the ways what things we can do, or what remedies we can do to get rid of or at least reduce the dark circles?
See, what first anything which comes is that what are the causes of dark circles? Now, dark circles could be hereditary or genetic. Your parents have it and you have it. So, that is one common cause. The other thing is that you are working too much in front of the laptop or your mobile, or you're going too much out in the sun and you are not using any kind of sun protection. So, if we are going out in the sun, we have to apply a sunscreen 20 minutes prior and keep reapplying 3 to 4 hourly to protect ourselves from the UV radiation. If we are into a field kind of job, or wear our goggles, which is very important. The other thing is that whenever we are working in front of the laptop or our mobiles, there is a form of infrared radiation known as blue light which is getting emitted, which again leads to dark circles. So again we have to take some form of sun protection in the form of sunscreens which give us this protection. So this is the second point. The third point is that maybe some people say that they are sleeping for 8 hours but they are not following the circadian or the biological clock. Means they may be sleeping at 5 in the night and getting up at 2 in the afternoon. So they are sleeping enough but the circadian rhythm is disturbed. So when you sleep for 7 to 8 hours, minimum of 7 hours and maximum of 8 hours, you should see that you are sleeping in that circadian rhythm. Means if you are sleeping at 11 o'clock at night and you are waking up at 2 in the afternoon, then you should see that your circadian rhythm is disturbed. So if you are sleeping at 11 in the night and you are waking up at 2 in the afternoon, then at 11 you are getting up at 8. So that is very important. Now the fourth point is that if you are sleeping at 11 in the night and you are waking up at 2 in the afternoon, then you are sleeping at 2. If you are sleeping at 2, you are getting up at 8. So that is very, very important. Hi.
Yeah, I think, yeah. Now I
Hi.
can hear you. It froze.
I think we got
Yeah.
stuck. I think we had some network issue. Yeah, it's cool. So the first point is you have to put a sunscreen whenever you're out in the sun. You have to put a sunscreen even if you're in front of your laptop or mobiles. The third point is that you have to sleep 7 to 8 hours according to the circadian rhythm. Because many flight attendants get dark circles because they are sleeping and they are going beyond or against the biological rhythm. Again, is that the dark circles could be genetic or hereditary. Then the dark circles could be due to hemoglobin deficiency or iron deficiency, or people who suffer from a genetic deficiency known as thalassemia. People who have thyroid disorders could again have dark circles, and people who have sinusitis or problems of cold and cough, they could have dark circles. Sometimes the shape of your eye socket could be hollow, so that can also give rise to appearance of dark circles because of that shallowness or that depth. So these are various causes of dark circles. Now, once we have found out the cause of dark circles, if it is a hemoglobin or thyroid deficiency or a vitamin B12 or vitamin D deficiency, it could be corrected. If you are not sleeping well, you can sleep well, especially mothers who have given birth to children and who are awake in the night with their small kids. Once they start sleeping right, their dark circles may just go away. Now the main problem is people who have smoking. I miss smoking. Smoking is another cause of dark circles because the nicotine in the smoke, it reduces the blood circulation around the eye, which is already very slow. So it can again give rise to dark circles. So once we have corrected vitamin D, B12, thyroid, all these troubles, and we are sleeping well, and we are sleeping with circadian rhythm, and we are also applying the sunscreen, the other thing remains is that if you have genetic dark circles, how to fight with them? Genetic dark circles cannot be treated. They have to be camouflaged with any good foundation or any kind of a cream which can conceal them. Good concealers. Now I have a very good tip, to get rid of dark circles. You just note down. You take some potato juice. You can crush the potatoes and take out the potato juice. You take out some cucumber juice, then pomegranate juice, and a little lemon juice. And you mix all these juices and you make ice cubes out of them. Then you rub these ice cubes for 20 minutes in the morning, 20 minutes in the evening, clockwise, anti-clockwise, or whenever you are going out somewhere or you have an occasion and you instantly want that the dark circles should not look very prominent, you just massage these ice cubes around your eyes clockwise and anti-clockwise, and it gives a very good dark circle reducing effect to your eyes. So it's cucumber juice, it's pomegranate juice, it's lemon juice, and it's potato juice. These are all bleaching agents which can give you that lightening effect before your any big occasion. The other important thing is that you can take some aloe vera gel and some fresh coconut oil, and you can mix those two, and you can again clockwise and anti-clockwise massage it around your eyes. It also reduces your dark circles. Tea bags are good to reduce dark circles. Potato cubes or cucumber cubes also reduce the dark circles. Then you can take some vitamin E capsule, Evian capsule. You can break it and mix it with some fresh orange juice. And if you rub it clockwise and anti-clockwise around your eyes, that also helps to reduce your dark circles. Now, if I go to high-end treatments, some under eye fillers, which last for almost 1 year, can give you a good effect on that hollowness or the depth or the tear trough, which is giving rise to prominent dark circles. So that can reduce it. We have beautiful treatments called arginine or lactic acid peels, which can reduce the dark circles. I have a beautiful equipment called AccuGel, wherein I use a skin lightening cream with microcurrents, which again helps to reduce the dark circles. So these are few things which can help. We have also some multivitamins by the name of Glasex, which taken also helps to reduce dark circles. There are some beautiful under eye lightening creams. I am also going to bring out my eye product known as Noor by Sunshine, which is a beautiful under eye cream which will soon come in the market in the new year. That also have incorporated beautiful ingredients. I'm going to market them, I'm going to show it on Instagram. That will also really help to reduce your dark circles. I'm coming up with a huge range of brightening, anti aging, and all these dark circle serums which will really help you all. So I have just enlisted these articles or these products which will really help you.
So can people go to your Instagram and find out about these products?
Yeah, they'll be launched in 2021 January. So it will be available and marketed on my Instagram site from January onwards. We are introducing a whole big range of our skincare and hair care products. So soon it will come out, and we are also launching some beautiful cellulite oils which will help you to fight with your cellulite along with your exercise.
Okay. Okay, thanks for that. And someone in the chat has said, I think reducing dark circles is a myth. So I think you've answered that very nicely, because there are different reasons for dark circles. And when you have it genetically, or when you have, if your eyes are deep set, those times you cannot fix or get rid of them unless you take help of, the fillers and things like that. But if it's due to sleep, if it's due to your diet, then I'm sure you can fix that. You can reduce your dark circles or get rid of them completely.
Yeah, it is the cause. So once you hit the cause, then you can know it. And if it cannot be removed, I have given you a lot of things to camouflage so that you can enjoy your life without being, feeling diffident that you have dark circles, and you can camouflage beautifully. So things which can be corrected in cosmetology, we'll correct. If they cannot be corrected, we'll reduce them so that you can camouflage and live your life beautifully, and there is no reason to be sad. We can play the tricks
Yeah,
to reduce it.
yeah. And makeup is always there to help
Yeah,
you
makeup is always there. Yeah,
camouflage the
that
circles.
Kriti is the boss. Can really help you with that. I can reduce it and you can camouflage it, so we both can help you out.
Yeah. Okay, let's move on to the next question. It's how to get rid of acne.
Okay. So pimples, as I said, it could have various causes. So once the cause is known, we have various treatments. Like first, I know the cause, and I'm going to give you some medications. I'm going to give you some medicated creams. Do not pick on your acne. We have beautiful treatments known as peels, salicylic acid and glycolic acid peels, which are alpha hydroxy acids, usually done once in 15 days. So they help to constrict down the size of the oil glands and clear your acne, and also work on the open pores and the marks. Now, if at all you have acne scars, then we have special treatments known as fractional CO2 laser and MNRF techniques. They help to constrict your pores and work on the acne scars. We also have beautiful LED light or blue light treatments which help to reduce your acne and to work on your scars. So for acne and acne scars, in gist, we have medicines, we have gels, we have peels, we have microdermabrasion, we have fractional CO2 laser, we have MNRF, we have derma rollers, and we also have blue light LED therapy. So all these therapies you have to meet your dermatologist and it will be taken care of. You can read about all this on my Instagram site, Sunshine Skin Clinic underscore official, and you can read about these therapies in detail. Or you can go to my website www.sunshineskinclinic.com and you can read about all these treatments in depth.
Okay, and for the acne, is there something people can do to reduce it and not have it as much as people do?
So you have to go back to my list of causes and to work upon your food, your diet, your control your dandruff. If you're doing oiling, just do for half an hour and wash. Eat well, sleep well, exercise well. There should be no hormonal imbalance. So just hit out my list, which I answered the first question, and you can just work
Yeah,
upon the causes, and I think you can take care of your acne. You can be your own doctor.
yeah. Yeah, because I think it's easier to prevent something before it happens rather than going for a solution. But some people who have, genetical acne because of all these different medical reasons, that's when you come in and you can help them with the with your creams and your treatments and things like that. So it's very good to see a dermatologist if you have serious issues with acne and acne scars.
Yeah.
Okay, moving on to the next question. It's, are toners really that important in a skincare routine?
Yes, toners are very, very important in skincare routine because nowadays the pollution levels definitely have come down because of corona lockdown. But otherwise, in Delhi or in India or all over the world, it's not that much. But in India, yes, pollution level is very, very high. So once we cleanse our face, the dirt and the muck doesn't come out completely. So a toner basically helps to attract that dirt out and cleans the pore open and also helps to constrict the pores because once the dirt is there in the pores even after washing with the cleanser, if the dirt particles do not come out, we'll have open pores. So toners basically helps to remove those dirt particles stuck deep and helps to constrict the pores. Now what is the difference between a toner and an astringent? Now people who have very very oily skin sometimes also use astringents, but astringents are rich in alcohol and toner is something which is alcohol free. So always prefer to go for toners because alcohol will again dehydrate your skin. It will make your skin dry and scaly. So do not go for astringents, go for toners in your normal routine and you can prefer natural toners like rose water and cucumber water or potato juice to clean your skin. Rose water and cucumber water are very very efficient toners and you can use them, and person of any skin type, oily, dry, sensitive combination can use this natural toners to cleanse their skin and to constrict their pores.
I'd just like to add to this because I have a very dry skin. So when I wash my face with a cleanser, my face feels really very dry and it actually hurts. It's that dry. So after I apply a toner, it already starts to feel much better. So for me, using a toner is very important. Especially, I feel like for dry skins, it works
Very
wonders.
good.
If I
Yeah.
uh, if I directly apply moisturizer to my skin, it still doesn't give me that feeling that a toner and then a moisturizer gives on my skin.
Yeah, the toner is very, very important. Some people, also use spring water or micelle water. It is also there in the market from Bioderma and Sesderma and companies like this. So, spring water or micelle water is also a good toner. Or sometimes some makeup removers have micelle water, which also work as toners. So, I think outside India, they use a lot of micelle or spring water as a toner, so you also get that in the Indian market. So you can try that as well. I prefer rose water and cucumber water, which I advocate to my patients also because it's freely available. It's not very costly and very much approachable. So you can try that also. Just spray it on a piece of cotton and you can just dab your face, not rub it, just dab your face.
Okay. All right. Moving on to the next question. How to get rid of puffiness under the eyes?
See, this is a very, very difficult question and a very, very difficult thing to treat also. Puffiness under the eyes usually is genetic, or it happens in people who have some liver or kidney disorder, who have lots and lots of water retention in the body, especially also people suffering from thyroid. So, puffiness under the eyes does not have an absolute 100% treatment. We definitely have a microcurrent machine known as AccuGel, but with that, you have to take treatments weekly throughout your life. Okay, so you have to control your liver problems, your thyroid problems. If you have genetic eye bags, sometimes the plastic surgeons are doing some kind of surgeries with which we can reduce the eye bags, but nothing can remove it completely. The best solution is that try to get rid of the water retention. So do not have very salty things after 5 p.m. Do not drink lots and lots of water after 5 p.m. And methi dana, you know,
And
that
I think sugar
coriander,
also.
avoid sugar, and methi dana or seeds of coriander. You can just soak a spoon in water in the night and drink that water in the morning. It also helps you to get rid of water retention. You can have jeera water, you can have methi dana water, you can have soft water. All these things help to remove the water retention in your body, which reduces the eye bags to some extent. You can do some aloe vera gel massage around your eyes or almond oil massage around your eyes, clockwise and anti-clockwise, to increase the blood circulation. You can do some icing around your eyes to increase the circulation. So these are some natural methods. Plastic surgery is an ultimate method to remove the eye bags. AccuGel is my non-invasive treatment, which you have to do weekly for your entire life. So we don't have a permanent treatment or any kind of creams to get rid of under eye puffiness. So this is a difficult thing to treat, quite difficult.
Okay. But that was very helpful though, because it's people who have it, it's very important for them to know the causes, because the causes are quite extreme. You have liver issues, you have thyroid issues, so it's also, I guess, a one way to know that you have these issues when you have the bags under your eyes or puffiness under your eyes.
Yeah.
Okay, moving on to the next question. Can you get rid of wrinkles or can you reduce wrinkles?
Yes, you can definitely get rid of wrinkles, but you have to be very, very careful with it. I think.
Hi, Dr. Namrata, you're back. I was about to close off the session because I thought
Oh, my
something
screen
happened.
froze. There was some technical issue, I think.
Okay, all right, no worries. We can continue. We still have people watching us, so we can continue and we can talk about the same question. I think I didn't get anything from your answers from this question, so maybe we
Yeah.
can just start over.
Yeah. See, we can definitely get rid of wrinkles, and but we have to be starting it from a very early age, like 25 plus or 30 plus. We have to start using, anti-aging creams which are rich in collagen, hyaluronic acid, glycerin, aloe vera, vitamin E, all the peptides. So we should start that. Start using a sunscreen so that you are not getting damaged from the sunlight. You are not getting wrinkles because of excessive sun exposure. Try and eat healthy, drink lots and lots of water, because water also gives lots of hydration to our skin. So that is also very, very important. Now, once you start doing these things, the wrinkle formation will get delayed, and you can also start with a facial known as photofacial or phototherapy, which you take once a month, in which we give you LED or the light sessions which stimulate your collagen formation, so that you can start 30 plus. Okay, even many females are taking it 25 plus. So the earlier you start with photofacials, the lesser your chances of getting wrinkles because it keeps your collagens boosted. Also, you can have some collagen drink which is rich in marine collagen. Vegetable collagen is a myth, it may not support you that much. You need animal or the marine collagen to give you that kind of collagen supplement. You can treatments wherein you can take mesotherapy or glutathione therapies. Those peels also, a lot of chemical peels also give you a good boost in the collagen formation. So all these things you should start. Now, once you haven't done all these things and you have proper formation of wrinkles like the forehead lines or the crow's feet or the glabellar lines, or you have those static lines, then you should go in for Botox and fillers. Botox and fillers are very, very safe to take. It is not a myth, and it is no danger that you are going to die or you are going to have a frozen look. Just go to the right kind of dermatologist and work with Botox and fillers for very, very good results, because once you start with them, they themselves stimulate collagen. So imagine if you have crow's feet once you're smiling and you start your Botox early, so the requirement of Botox is also reduced, and those crow's feet or those dynamic wrinkles which are coming on doing an action will not turn into static wrinkles. So it will be a prevention, because once those lines get formed permanently, then we cannot erase them. So Botox and fillers is a very, very good way. There is a latest RF technique known as thermage, which also helps in facelifting. We have a therapy known as UL therapy, which is ultrasonic therapy to stimulate collagen, which also gives very, very good results. So please go for treatments like even PRP or the blood therapy or the vampire facials, which we do, wherein we take your blood, make stem cells, and inject in your skin, also help you to get rid of wrinkles. So you can take peels, you can take mesotherapy, you can take vampire facials, you can take photofacials, you can take thermage, UL therapy, Botox, fillers, even thread lifts. So all these variety of treatments are available for giving you a young and good looking skin and boosted up and elevated skin. So yes, definitely you can get rid of wrinkles. But if you are a person who has got enlightened at the age of 70, wherein your entire skin has sagged down, and then you are expecting us to get rid of wrinkles, then it will be very difficult. So you have to start early. 30 plus is the best time when you get activated, and you'll stay wrinkle free for quite some time, for quite long. Even in your 60s and 70s, you can look very graceful with these treatments. You will not look frozen, you look very beautiful, and you can look young. All the heroines abroad who do all
Even
this, and they stay young for quite a long
even with
time.
the Botox, it's possible to look natural because I've seen. I mean, when you see those surgeries gone wrong or too much Botox and things like that, and the face looks really unnatural.
So
But
that
is that just an extreme case, or is it possible?
you can look very beautiful with Botox and fillers done naturally. You have to find the right person. Never go to a layman. Nowadays, many paramedical people like dentists, physiotherapists, and many beauty parlors and all such people have started doing Botox and fillers. So you have to go to a right dermatologist or a plastic surgeon or the right kind of qualified person who has a degree to do this, because Botox and fillers can definitely go wrong, and you have to go to the right person who can actually you can judge your face and give you the right kind of units to make you look young and beautiful.
Okay. All right. Moving on to the next question. We have last three questions left. We're going to do them quickly. Is shaving better or waxing? I guess this is mainly for women. They're trying to get rid of their body hair. And which one is a better option if they had to choose one?
We used to shave or wax when lasers were not introduced, but now we have such beautiful hair reduction lasers in the market which give you a permanent hair reduction. So I do not prefer any shaving or waxing. I just advise if you're really hairy and it is uncomfortable, please go in for laser hair reduction. Just choose your good machine like an Indiac or a Diode, a US FDA approved machine. Go into the right center and get the laser done once for all, and you can get rid of shaving and waxing for quite long time without any side effects. So I do not go for any waxing or shaving. You just go for laser hair reduction, and you can be really happy with the results.
And the results, are they permanent, or do you have to, once you've gotten the long-term treatment with few sittings, do you have to go again after a few years, or
See,
can
it's
you
a
permanently thin?
yeah. See, laser hair reduction is permanent, except the face part. If you are suffering from any hormonal problem, the hormonal problem has to be corrected, and then if you take the laser, the results are permanent, wherein your hair goes very, very fine and less, so that you can leave it as it is. Or if you want, you can do a slight shaving with a lady shaver. Otherwise, you don't. Your hair does not come back that in that thick form, and your body hair is not dependent on the hormone, so that result is almost permanent, but it's a permanent hair reduction. It does not give you a wax appearance look. The hair still comes, but it is very, very fine and less, which you can leave as it is, or you can just shave it.
Okay. Thanks for the answer. Let's move on to the next question. It's, do eye creams really work?
So, see, I think I have answered this. Eye creams do work. You have to find out the cause of dark circles to treat the cause, and then if you use any kind of creams or treatments, they will really work.
Okay. And also, you are coming up with your own eye cream, as you mentioned before. I'm really looking forward to your products. And since you are, I mean, you've been giving us so much information, and like you've been helping us out so much on our live sessions, I'm sure whatever you put in those eye creams is definitely going to be good ingredients and good product. So we're definitely looking forward to trying out your products.
See, we have a research team and we are going to introduce allopathic, Ayurvedic products all together because India is a land of herbs. We have so much history, we have so much Ayurveda, works beautifully. So, my products won't be totally cosmetic. They are going to be from the Indian background, they are going to be herbal, we are going to put aesthetic things or cosmetic things also wherever required, but they are going to be very natural, which do not give you any side effects and definitely give you results. So just look forward to our products which are going to come soon, and I'm sure they're going to help you.
Yeah, we are looking forward to your products. And now we have the very last question for this session today. It's, what is carbon facial?
So see, this is a very beautiful facial and it is trending nowadays. If you would have heard of charcoal masks, a lot of people are using charcoal masks. So this is basically charcoal or carbon is an ingredient which can absorb all the dirt and the muck from your skin and can give you a glowing skin. So a carbon facial in my clinic, how it is done is that a person who walks in, we do first we do the cleaning of the face, then we do a water and an oxygen exfoliation to remove the dead skin. We introduce all the brightening and lightening agents into the skin with the help of microcurrents, which also help to tone your skin, to brighten your skin, and also to lift your skin. And the fourth part is we do a cold tapping, and the last part is we put a carbon peel. It's a carbon peel. We have a special peel which is rich in carbon or charcoal, and then we have our Q switch laser with which we give the shots. So Q switch laser, it penetrates the skin deep through the carbon peel or the carbon or the charcoal mask, and then it removes all the dirt and the myth. And once we remove it, it gives you a very, very radiant and bright skin. And if you are a bride or you have a session or even if you have a party, you can just do a carbon facial and then just do your makeup or go without your makeup, whatever. But you can have a good radiant skin and you are just ready for the party. So it's a beautiful thing. And if you visit my Instagram site, I have also put a video of carbon facial which you can just check out in my initial post and you can get a live demonstration as to how we do it.
And is this, I mean, you've answered this before for other things, but is this also something you do before going for a function, or is it also something you can do regularly as your routine and for a good skin?
See, you can do it regularly as a routine once a month, but if your skin is not looking great and a party has come up or you are suddenly getting engaged and you have to get that glow and we do not have enough time for treatments, you can just take it and you're ready for the D-Day. It gives you instant results.
Okay. Okay.